Blood transfusion. Some of the indications of blood transfusion are blood loss, blood disorders, blood diseases, poisoning, and acute infections and shock. Some of the complications of blood transfusion are which are due to the mismatched transfusion where antibodies in the recipient serum attach to the antigens of the donor's RBC. This antigen antibody reaction leads to agglutination, that is, they form the clumps. The RBC is first agglutinated and then undergo hemolysis. The clumps of cells may block smaller blood vessels in the coronary, pulmonary, and renal circulation. This may result in shock. The hemolyzed RBCs causes increase in the release of hemoglobin, which gets metabolized to bilirubin and may lead to jaundice. If the amount of hemoglobin in the renal tubules is sufficiently high, the kidney failure can develop. Some of the complications which are not due to the mismatched blood transfusion. There can be excess volume transfusion which can lead to hypervolemia, and as stored blood cells lose potassium to the external plasma, hyperkalemia results. Or blood is stored using citrates and transfused blood contains enough citrates. With a massive transfusion of citrated blood, citrate removes calcium ions of recipient blood. This results in hypocalcemia. There can be chances of hemosiderosis which occurs because of the deposition of excess iron. Pyrogenic reactions like fever can occur, allergic reactions and shock can occur because of the released cytokines. And can be transmission of diseases like AIDS, malaria, syphilis when you're doing blood transfusion. So hazards of blood transfusion can be due to the mismatched blood transfusion and due to the blood transfusion. Because of the mismatched blood transfusion, there can be immediate effect, delayed effect. Immediate effects are hemolysis, shock, and renal failure, whereas delayed effect is jaundice. Due to the match blood transfusion, there can be again immediate manifestation or delayed manifestations. Immediate manifestations or complications are pyrogen reaction, shock, coronary overload, hyperkalemia, and hypokalemia, whereas delayed complications are transmission of the diseases and hemosiderosis. Blood storage. For better long-term preservation of blood and for transfusion purposes, citrate is used in combination with dextrose in following forms. Acid citrate dextrose, that is ACD solution, trisodium citrate, citric acid, and dextrose. The pH is 5.4, where you have to add 10 volumes of blood to 1.5 volumes of the solution. This form of the blood can be stored up to 21 days. Citrate phosphate dextrose adenine, that is CPDA solution, where you have sodium citrate, citric acid, dextrose, and adenine. pH is between 5.6 to 5.8. You have to add 7 volumes of blood to 1 volume of solution. This form of blood can be stored up to 35 days. And dextrose acts by liberating lactic acid, which by decreasing pH helps in survival of RBCs both in vitro and in vivo, providing substrate for the metabolism which is required even at 4 degrees Celsius and thus helps the survival of the cells. So that is the function of dextrose. Changes which occur in the stored blood. Blood stored in the blood bank suffers some changes. There is a decrease in 2,3-DPG, so there is increase in the affinity of hemoglobin to oxygen, increase in potassium concentration in plasma, so there could be a chance of hyperkalemia. There is increase in the concentration of sodium in the RBC, decreased viability of RBC so that they cannot work for longer time due to the decreased ATP in them. There might be decrease in the platelet count, and there might be increase in the